Super nice to see you. I don't know if you remember me, but my name is Lee. I'm the medical assistant that's going to be gathering your history and chief complaint, as well as getting your vital signs. You remember me? All right, fantastic. Well, tell me what's bringing you in today. Okay. So you sort of feel like your periods, a day before and the first day that you bleed, it's extremely painful. Okay. And have they always been like that? Is this a new thing? Sort of always. Okay. Now, have you tried any medication to help manage the discomfort? You take Advil. It helps a little bit, but not completely. Okay. Now, how would you rate your pain on a scale of 0 to 10, 10 being the worst pain of your life? Okay. And do you feel like it impacts your quality of life to such a degree where you can't go to school, you can't continue work? Okay. All right, excellent. And since I have last seen you, no new changes to your medical history, surgical? No? Okay, all right. Well, we will get this taken care of for you, absolutely. Now, I'm gonna grab your vitals if that's okay. Cool, thank you. So anything new, aside from you coming in for this? The summer did go by fast, right? All right. Blood pressure first. You want to use this arm, this arm, this arm. Okay. No problem. If you could just uncross your feet for me. Thank you. Blood pressure is good. Alright. And of course, no flu-like symptoms, no recent exposure to COVID. Okay, no shortness of breath or cough. Awesome. Alright. I know, isn't it crazy how much this world has changed? Been good. Thank you. Thank you. Been pretty busy. Yep. What's going on with this one? This one's a little funky. Alright, right under the tongue per usual. I know the music's not too bad today. Alright, no fever. That's awesome. Oh yeah, a lot of people come in with concerns of painful periods, and there's definitely a particular workup we do, and then we sort of see, what are your goals as far as management? What are you opposed to trying? What are you willing to try? Right, and Leanna, the PA, she'll kind of go over all of that with you, and then we'll kind of hopefully, resolve everything and make your quality of life so much better. Anyone in your family? Your mom and your sisters have painful periods. Okay. Oh, the birth control? Yeah, what are your thoughts on that? Is that something you're interested in or would rather not have? Interested. All right, I'll let the PA know for sure. It does work. Personal story. I suffered from painful periods for many, many years of my life. Very painful. Like, I would throw up. I would never be able to go to school or continue work. I was given a birth control pill and my life has changed. Yeah, I honestly can't even imagine myself not being on the pill just because nowadays I don't even have to take an Advil or Motrin. Yeah, so you came to the right place. So let me kind of show you what we're gonna want. Now, whenever someone comes in for painful periods, it's always good if they are active to just get like a routine gonorrhea chlamydia check just to rule out things like pelvic inflammatory disease. Are you okay with that? Okay, cool. So I'm gonna leave you this urine cup. You're just gonna leave me the sample before you see the PA. And then she is probably going to want to do a pelvic exam just to rule out any, internal anomalies. Is that something you're okay with? Awesome. And so she will do the pelvic exam with the speculum, which I know we've introduced a few times. Yes. And then I will be sure to take out some lubricant. We need the lubricant for sure. And then after that, she will sort of tell you what she sees and then if she thinks any imaging is warranted, depending on, of course, what you're looking for as well, and we'll kind of figure out a plan. Absolutely. So with that being said, I'm gonna leave now. And then you leave me that urine sample. When you come back into the office, we're just gonna need you to get undressed, waist down. Everything top-wise stays on. You'll take this drape that I left you, lay it over your waist for some privacy, and then we will come right in and get everything going. My pleasure. Always nice seeing you. Leanna will be in soon. See ya. Hello. Very nice to see you. Just of course not under these circumstances. How have you been doing? The family's doing okay? Good, good. So Lee kind of gave me a rundown. She sort of explained that your whole life you sort of had very painful periods, usually the day before in the first couple days. Right, and then Motrin and Advil not really working. I mean, they work a little bit, but just not perfectly. Okay, all right. She was also telling me, you are not opposed to starting on birth control. You've had family members with success with that. Sure, absolutely. Now let me ask you a couple more questions. Do you ever feel that you get pelvic pain outside of your period? Okay, no. And is sex painful at all? No. And no issues with bowels or anything like that? Okay, so just strictly the period pain. Okay, all right. Now, are you okay if I do a quick pelvic exam? Perfect. And I'm also just going to press on you on the top here on your lower belly, and you let me know if any of that hurts. Okay, all right. Yes, we'll get started. So there's this condition. It's called primary dysmenorrhea. It's just a fancy way of saying painful periods. And the thought is that, individuals with painful periods release excess amounts of prostaglandin in their body, which is what can, cause painful contractions, like uterine contractions when on the period. And it's essentially what we call a diagnosis of exclusion, meaning we rule out things like PID, endometriosis, other conditions that it could cause. Now, assuming the pelvic exam is normal, we may want to consider an ultrasound just to rule out cysts or masses. But if that checks out, then it's most probably primary dysmenorrhea, given that it only happens at time of period. And we'll talk about therapy options once this is over. Yeah, for sure. All right. Doing okay? Yeah, just you wouldn't mind scooting down a little bit more for me. Perfect there. All right, so I'm gonna look outside first, just kind of get body used to touch. No obvious abnormalities on the outside. I'm gonna press on you here. You let me know if it's painful. Any pain at all? Okay. Now we're gonna do the pelvic exam. And yes, I'll put lubricant. Yes. We are starting with the small size, per usual. All right, you're gonna feel my hands here. Gonna feel that colder pressure. Doing okay? Good, you let me know if you're not. Cervix looks healthy, no masses or polyps. All right, I'm gonna pull this out. And are you okay if I just do an exam with my fingers? Okay. Examination is done. So let's talk a little bit about what I saw. Okay, kind of cover you up here. You feel okay? Good. So, your exam was normal. I think it might be a good idea for us to get an ultrasound just to be thorough and make sure we're not missing any cysts or masses. You would like that too? Okay. So we'll get that ultrasound. Now, a lot of times with conditions like primary dysmenorrhea or painful periods, we sort of work in steps. So the first step is more of things non-medication related, like exercise and using heating pads. So that's step number 1. Now, step number 2 is using NSAIDs, or things like Motrin, ibuprofen, and Advil. And that is because the way NSAIDs work is they actually, block prostaglandin, which is what we assume to be the root for the painful periods. And so that's why it kind of works for you, but doesn't completely resolve the symptoms. And then the next step, as long as you are not trying to get pregnant and you are not looking for more like intensive follow-up, meaning like a surgical laparoscopy, we would recommend trying birth control pills. Now, for a lot of patients, birth control pills improve their periods drastically to the point where they don't have to take one pain medication pill, and they can also be used as a form of birth control. Now, if the birth control pills do not work, then we may want to consider what we call a laparoscopy to rule out other conditions like endometriosis. Exactly. So we never want to jump to surgical intervention right away, especially if your symptoms are well resolved with something like a birth control pill. But if you were completely opposed to being on anything hormonal, I would say that, getting a laparoscopy would be a reasonable alternative, assuming, again, you did not want birth control at all. Right, and so for birth control that can help treat painful periods, you have a few options. You have the birth control pills, the depot shot, the hormonal IUD. You're more interested in the pills? Okay, give me 1 second. Let me grab my booklet. So, first thing we're going to do is order you an ultrasound. Are you okay with a transvaginal ultrasound? Okay. And that's just to rule out structural things. Now, given your pain is only during the first couple days of your period, I do have less suspicion for conditions like endo or adenomyosis, but something to consider in the future, again, if the pills don't work. Sound like a plan? Okay. Yeah, I know you kind of wanted to be on the pill. Right. All right. Now, to be on a birth control pill that helps manage periods, we have to make sure you're an estrogen candidate. You don't have any medical conditions, no history of migraine with aura, blood pressure problems, blood clot disorders. Okay, and you're a non-smoker. Excellent. So you are someone who will be okay having estrogen hormone in the pill as well. And so what I'm going to do is I'm going to send you a low-dose birth control pill. I want to see you in 3 months to make sure you're happy with that pill. I always tell people the first month or two you may get some side effects like nauseousness, headaches, mood swings, bloating. But by month 3, I would want you to be completely happy with that pill. And if you're not, then we will talk about either adjusting the dose or considering an alternative method. Right. Now, of course, though, if you ever experience chest pain, leg pain or swelling, palpitations, you would let me know and we would probably discontinue that. Right. Do you have any questions? All right, well, I am going to print you off some info regarding the birth control pill. We will send it over today and I'll see you in 3 months for that. When you get your ultrasound done, I'm going to call you to review the results. But based on your assessment today, I suspect it will probably be normal, but we're just being sure. Yes, absolutely. And what you'll do is you will start your birth control pill on your next period, the Sunday of your next period. And hopefully that will be the last uncomfortable period you have. For sure, for sure. And like I said, if these pills don't work, we're going to look more into it for you. Absolutely, my pleasure. Well, it was nice seeing you, and I will see you in 3 months. For sure. All right, I will send over the prescription and the ultrasound imaging report now. All right, see you later.